Okay, first things first. When you have a patient come in, you're going to have them fill out the registration form or intake form. Have them fill out the front and the back. It's a 2-page form. It's real simple. Then after you have them fill that, you bring them back to the room. You're going to want your calipers ready, and you're going to want this body fat sheet ready. And then I'll go into how to do the body fat next. This is how you do a body fat percentage. You're going to pinch the same areas as a man, as a woman. It's just the multiplication that's different. So when we do body fat pinching using a caliper, first we're going to start with the tricep. So then what we're going to do is middle of the tricep. You're going to go to the muscle, down to the muscle, and then pull off the muscle. All you want to do is want to grab the skin and fat. That's all you want. And then what you're going to do is this caliper will measure, and whatever that number is, you write it down. Then you can go to bicep, just like that. What we do is we go to chest, just like that. Then after that, we go to the belly button, and right next to the belly button, we do the same. And then all we do, pinch. We're going to go to the left side of the back, right underneath the scapular bone. It's called subscapular. Pinch it, measure. Kidney, which is on this side, pinch it, measure. Then what we're going to do is we're going to go to the suprailiac, which is, suprailiac means it's just above the hip bone. So you go touch the hip bone, right above it, pinch, same thing. Then what we do is have the patient turn face towards me. Same thing with the quad. Down to the muscle, pinch off of it, boom. And then the last pinch is on the calf, go to the muscle, pinch, pull off, and get that number. And that's how you do body fat on men and women. Thanks. So basically, I took all the numbers that I needed to take on this particular female. This particular female is 45, she's 5'3". So I pinched her all these times like I showed you in the previous video how to pinch. Now what we got to do is we just got to do the multiplication of it. So I'm going to explain it very thoroughly for you. So we added up all the numbers. The total was 293. Her weight is 171.4. What I put right underneath the weight is, okay, what's your goal weight? So I put the goal weight right underneath there. So this is her weight today and her goal weight. Then what I do is to find out her body, I want to find out two things: her body fat percentage, her fat pounds, and her lean muscle mass. So it's all numbers. So I already have the total of me pinching her fat. I have her weight. So now it's just multiplication. So basically we take the total of the numbers that you added up, divide that by the weight. So I got the total divided by the weight, and that number is 1.70. Now, she's a female, so I take the 1.70, multiply it by 0.3, and that'll give me a body fat percentage, which for her is 51% body fat. Now that I have her body fat, I want to know how much of her is fat and how much of her is muscle. So to find that, how many pounds of her is fat, I take the body fat percentage, multiply it by what she weighs, and that tells me that 88 pounds of the 171.4 pounds is fat. Now, after I find that out, I want to know how much of her is lean muscle mass. So I take her weight minus her fat pounds. That leaves left 83.4 pounds of lean muscle mass. But that number also includes muscles, tissues, bones, organs, eyeballs, teeth, hair, fingernails, and water weight. So that's just an approximation. Now we're going to return to her body fat. We know her body fat percentage is 51%. Now, what does that really mean for her? So that's when you get out the body fat standard values for body fat percentage. So we know her age is 45, so we go to women, we go to 45 and look at 51%, which is down here, which is, if we come over here, beyond poor. Now, where do I want everybody? I want everybody at average. So I want her here, but she's down here. So that's why on this sheet, we put a beyond poor right there. Now, once we've figured out that, we want to educate her on why is this all happening? What's the purpose of this? So let's return back to our lean muscle mass. Her lean muscle mass is 83.4 pounds of lean muscle mass. But like I said, that includes other stuff. Women's lean muscle mass should be between 100 and 120. And the thing of it is she's not even close. So that tells me something about her, because lean muscle mass is dictated by the amount of protein that somebody ingests. For her, she's not getting enough protein, or else that number would have been within its normal values. For men, this number should be between 150 and 190. So if it's below that, they're not getting enough protein. If it's way above that, they're getting too much. So for her, on this example, she's not getting enough protein. So what's the big deal about that? Here's the big deal. Just by eating more protein, this number will go up. The more lean muscle mass you have, the more calories you're burning at rest. So just by eating more protein, lean muscle mass goes up. The more muscle you have, the more calories you're burning at rest. The more fat you're burning at rest, scale is going to go down. So you got to let them know that that's so important. Now, body fat percentage and fat pounds are called directly proportional, which means if that number goes up, this number goes up. But if that number goes down, this number goes down. These two numbers are dictated by the other two things that go in your mouth, which are carbs and fats. So I know this. If her body fat percentage is beyond poor, then what she's put in your mouth also has to be beyond poor, because if it was poor, fair, average, good, or excellent, the numbers would dictate that. And the only person that can control these numbers is the patient. We already talked to the patient about their body fat percentage and they're feeling horrible, and they're like, okay, I ask them, okay, do you understand that? They say they understand, and it's all numbers. So after that, you kind of want to ask them, okay, we have many things here to help you lose weight.
Yeah, for you.
What are you looking for to lose weight? I ask them that to see, okay, maybe to talk to their friends or on the internet or whatever. If not, then I say, okay, I could teach you about everything that we have if you don't know what you want. So here's where we go into more detail. So for your particular office, we're going to focus on 4 products. We're going to focus on the phentermine plan, which is a 90-day prescription of phentermine. It comes with an exam and an EKG, because anytime we give a stimulant, we are responsible for that. I tell them that. That 90-day program of phentermine runs $5.99. If they want to break it up into payments of $1.99 a month, they're welcome to do so. So let them know that. Once they decide that, then that's when you sign them up. Then your other options are going to be, we have the semaglutide, we have the tirzepatide, and we have the retatrutide, which is the newest product that just came out. Now, this one, the semaglutide, is not dose dependent because it's a cheap product. The other ones are dose dependent, and here's how the dosage would happen on these two. Now, if you have somebody who's like 180 or less than 200, I'd probably put them on the first dose. And for here, it just depends. The more weeks that they purchase, the cheaper the cost is. So it's up to them whether they want to commit to 1 month, 2 months, or even 3 months, depending on the product. Okay? Now, anybody who's over 200, I automatically tell them, hey, this won't do nothing for you. You got to go on a second dose of whatever product that you choose. So they'll ask about the phentermine. Now, what does the phentermine do? Well, the phentermine is an appetite suppressant. So if you're a foodie, it's going to knock that out. The other part of phentermine is that it's a stimulant. So meaning your heart rate's going to beat faster. If your heart rate's beating faster, you're burning more calories, burning more fat, scale goes down. But you got to let them know, the way to solve all this problem of weight gain is how we all want to look as a function of calories in versus calories out. So let them know that, okay, the phentermine is going to do their job, but you have to diet and exercise along with it to solve the problem. What we have here is the GLP-1s. Basically, the GLP-1 stands for glucagon-like peptides. Basically, it's one injection a week into the belly fat, which they call sub-Q. What it does is it regulates your blood sugar levels. And I'll go into more detail in a second. So the GLP-1s right now, currently, we have the semaglutide. We have the semaglutide, also known as the Ozempic and Wegovy. Then we have the Mounjaro, also known as the tirzepatide. Then we have the newest one that just came out probably 3 or 4 weeks ago. It's the retatrutide. I'm going to talk to you about each one individually. So let's start out with the semaglutide. Now, semaglutide is supposed to work on one hormone and it it regulates your blood sugar levels like all these do. The tirzepatide works on 2 hormones. The retatrutide works on 3 hormones. Now, what's the difference? The difference is this. They all regulate your blood sugar levels. So when you go to eat, you get satisfied quicker. So you're not going to eat a whole plate of food, you're going to eat a quarter of that plate, so all those extra calories are not going in. Now, two of these have side effects, these two, the semaglutide and the tirzepatide. Now, it's kind of a good and a bad thing, because here's the thing, remember, it regulates your blood sugar levels, so it's going to curb your appetite. Now, it's a drug and they have side effects, these two. Side effects are nausea, vomiting, diarrhea, stomach issues. How does that happen? More often than not, I see in my female patients nauseousness. Males, no, for some reason we don't get side effects on this particular drug. But women have a tendency to. Now, it's kind of a good thing though, because the side effects come, nauseousness comes. If you don't eat, you're going to get nauseous. If you eat to get satisfied, you're good to go. If you eat beyond that, you're going to get nauseous. If you eat fried fatty foods, nauseous. And the other thing that they were finding out is it helps with addictions. So if you're somebody who likes to have a beer every day or a glass of wine every week, a week into this, you're going to taste it and it will taste good to you, which is kind of good, because then those empty calories are not going in your system, because you don't have an affinity or it doesn't taste good to you. So that's the good part between these two. Now, what else I want to tell you about these two? Like I said, one works on one hormone, this works on two hormones. Now, my choice would be this. If you had zero health issues, cost-effective way is the semaglutide. If you have any health issues, I would choose either tirzepatide or the retatrutide. Now, what's the difference between these two? Well, the difference is the tirzepatide and also the semaglutide have side effects. Works on one hormone, two hormone. The retatrutide works on three hormones, and also there's no side effects. And the other plus to the retatrutide is there's no muscle tissue loss, versus the semaglutide and the tirzepatide. One of the other side effects is muscle tissue loss. And on this particular patient that we just did, her lean muscle mass is below what it should be, so I'd probably leave it up to her to decide, okay, maybe she wants to take the more expensive one versus the tirzepatide or the semaglutide to prevent muscle tissue loss. Or she has to ingest more protein to prevent muscle tissue loss. So that's this skinny on both, on the semaglutide, tirzepatide, and the retatrutide. They chose, let's go with the semaglutide, because it's just basic. So, and they just want to do 1 month. So the cost on the 1 month of the semaglutide is going to run $450. So this is going to be the investment sheet. So next, you want them to fill out the top part. We don't need them to take a deposit, because they're going to pay up front all of it. So then what would you do is put $450, 1 month, I just put SEMA. You sign here, and then you have the patient sign and date that. And then you take payment. Then once you take payment, what you want to do is mark the dosage, the date, their weight, you want to take their blood pressure and their heart rate. Put their name down, date of birth, and cell number. So this is how you would do it. Put their name, date of birth, cell number, put whatever date it is, put the dosage. So let's say she got the SEMA and she's on the semaglutide. So we'll put SEMA, 4 shots, and the dosage on the semaglutide is going to be 0.25 milligrams, or it's going to be 10 units. Depends on whether the product's cold or it could be at room temperature. And then obviously we want to write their weight down. This particular patient's weight is going to be 171.4. Once you do that, take their blood pressure, put that down, done. Now, as far as dosing is concerned, here's the deal on dosing. I told you about it earlier, about if they're under 200 or whatever. The same thing goes for even the semaglutide. If they're over 200, if they're under 200, I'd say the safe bet is going to be 0.25 milligrams. If they're over 200, I'd start them off on a 0.5 milligrams, which would equal 20 units. So that's what you would do with the semaglutide. I already told you earlier about the tirzepatide, and I told you about the retatrutide. Okay, so now what we're going to do is once you've explained to them everything, took the blood pressure, filled out the injection sheet. Now you got to preload these 4 syringes because they're going to do once a week in the belly fat. The first shot, you're going to show them how to do it, and then the rest of the 3, they're going to do it on that day, every other week for the next 3 weeks. When they run out of shots, what I tell them is, okay, after your last shot, call office or text me, and we'll schedule you to come in to pick up more shots. Now, here's how you do make the shots for them. So here we have shots that are going to be cold, and on here we got shots that don't have to be refrigerated. So these are refrigerated, these are not refrigerated. The purpose of that is I have some patients that have got to go fly somewhere, or maybe it's a long distance, so then I'm not going to give them this because it probably won't stay. Versus this, they can fly around the world, doesn't matter, the shots are always going to be good. Now, here's how you do it. Pull off the top, take the product, it could be the not cold or the cold, and all you're going to do, put it in there, turn it upside down, draw out the amount that you need. And you want to do that for the rest of the shots. After you do that, what you're going to do is whatever, you're going to put all the shots in the bag. Plus you want to give them alcohol prep pads because it makes it easier on them. You can put it in the bag or slide it in here. Or for these, you can put them in the bag because it's not going to get wet or anything. So it's easier for you to just put it in the bag and then put it in that, and then put it in that. Seal it up for them, and they're good to go. What you want to do with the first shot is you just want to show them how to do it. You're going to wipe down an area in their belly fat with one of these. Doesn't matter. It could be belly or it could be in their thigh, wherever they're fat, wherever they have fat. Doesn't matter, either one. And then what they're going to do is you're going to take the top off, give it to them, and say, okay, just put it in there, and then put the plunger down. Voila, that's it. Let them know that after they do the shot, what they could do is take an empty water bottle, put this in the water bottle that's empty, and then what you can do, throw it in the garbage. So just don't throw it in the garbage without it being in an empty water bottle. That's it.